Have you recently been diagnosed with mixed connective tissue disease and you found yourself wondering, what does it mean for me? Are you feeling uncertain about the treatment options and how to manage this condition effectively? Let me tell you, you're not alone. And I'm here to help. In this video, I will explain how MCTD or mixed connective tissue disease is treated, and most importantly, I will share some actionable steps that you can take today, not only to manage your symptoms, but also to reduce your risk to develop complications. I am Dr. Girnita, a rheumatologist with over 15 years of clinical experience treating autoimmune diseases like MCTD. Through my practice, Rheumatologist on Call, I have helped thousands of patients to solve their medical mysteries. And if you listen to my previous video about the signs and symptoms of mixed connective tissue disease, you know that I call MCTD a puzzling autoimmune disease because it can look like lupus, scleroderma, polymyositis, and rheumatoid arthritis, but is none of this. Mixed connective tissue disease is a disease that can present gradually and incorporate many symptoms. Some can be more obvious, like joint pain or rashes, or Raynaud's phenomenon, severe muscle weakness, skin tightness, and heartburns. Other symptoms can be more subtle, like fatigue, diffuse muscle aches, chest pain that can come and go, shortness of breath, again, that can come and go, dryness of the eyes, dryness of the mouth, or non-specific abdominal pain, simple abdominal pain or bloating. Why does this matter for treatment? Because mixed connective tissue disease, it's not one size fits all. Actually, every patient is unique in their presentation. While some patients present with mild symptoms, as I mentioned, there are also patients who will present with severe symptoms. This is why I personalize the treatment to my patient's needs. I also listen carefully to my patient fears, to their desires, to their lifestyle choices, and their personal beliefs. Because there is no way I will tell a patient, this is my way of treating, and if you don't do what I say, you are no longer welcome here. And I know that many doctors these days look more at the charts and guidelines than they look at their patients. But in my practice, our approach is different. We work with every patient and we work for each patient. Maybe it sounds like a cliche, but this is how we do it, which is reflected in all our patients' reviews. How is MCTD treated? When I start my discussion about how we should treat MCTD, I have two goals in my mind. Number one, control the systemic inflammation and then decrease the activity of an overreactive immune system. And then number two, to manage specific symptoms or specific complications of that patient that is in front of me. Now, let's break this into more manageable steps. Number one, control the systemic inflammation. What does it mean to control systemic inflammation? When the immune system is fired by a virus, a bacteria, or another reason that we don't clearly understand, this will cause inflammation in order to attack and destroy. However, sometimes when this response is exaggerated, like in autoimmune diseases, the ongoing inflammation will cause damage to our tissues. And in order to stop that damage, we need to get in control of that immune system and decrease the activity of the immune system cells. But how can you achieve that? In some mild cases of MCTD, you can try some lifestyle changes, like an anti-inflammatory diet, improve your sleep, reduce your stress, or even use some supplements like vitamin D, turmeric, or omega-3s. But when you deal with more severe symptoms, and these measures do not help you, and you continue to have severe symptoms like joint pain, muscle pain, rashes, Raynaud's phenomenon, then it is best to try to stop the inflammation quickly. And first, let's talk about NSAIDs, or non-steroidal anti-inflammatory medications, like naproxen, or ibuprofen, or meloxicam. They can help you with your joint pain and muscle pain. But you need to be careful because if they are used in excess, they can have side effects like kidney issues or ulcerations of the stomach, or they can even increase your risk for heart attacks. If you have more severe symptoms like rashes, joint pain, fatigue, or ulcerations, then steroids might be an option. Corticosteroids like prednisone are wonderful drugs. Think of them as they are the firefighters, that they are putting inflammation down. And yes, they work very quickly and they will save the day. But unfortunately, they are not the long-term solution, as they can also cause side effects like thinning of the bones, increasing the risk for fractures, anxiety, mood changes. You can be irritable. They can cause sleep issues, gastric ulcerations, and they can also increase the risk for heart attack and diabetes. So the goal is to use them when needed for the shortest amount of time. Now let's go to my goal number 2, to manage the specific symptoms and complications. If the inflammation is persistent and if patients have more specific symptoms like ongoing hand or feet pain, or stiffness, or severe Raynaud's phenomenon, or let's say inflammation in the muscles, or lung and heart complications, me as a rheumatologist, I will go to the next level of treatment and manage these specific complications of the patient. So we can use certain types of medications that we call immunomodulatory or immunosuppressive drugs, because they modulate or they decrease and sometimes suppress the activity of the immune system. And these medications can replace the need to use more steroids, especially for those patients that have severe symptoms. Let's talk about DMARDs, or disease-modifying anti-rheumatic drugs. These medications include hydroxychloroquine or Plaquenil, methotrexate, and leflunomide, which they all will reduce the inflammation over the long term. These medications also require careful monitoring and visits with a rheumatologist, as they may carry a higher risk. However, please do not get scared or listen to all the people that had bad experiences. In my experience, many of my patients are able to tolerate these medications very well and they don't develop side effects. And those people that they do have a good experience don't even think to go on the internet and share their experience. While other people that do have a bad experience, they always go on the internet and they report that. I see my patients every month. I monitor their labs, their signs, their symptoms, and we discuss every possible side effect. And my patients are in constant communication with me. So if they experience something, they will share that with me via messages. And yes, it's important to have the right doctor and the right support system when you have an autoimmune disease. For patients that have Raynaud's phenomenon, I teach them how to protect their hands from cold. I teach them to use heated gloves when they are outside in the cold weather, to put their hands under the armpits to warm them up, or to run some warm water over the hands. All of this will help. So if the patients do not improve with these measures, then I will try treatments with medications like amlodipine or nifedipine. And when the situation is even worse, we use a medication called Viagra or sildenafil, which will open up the vessels in the hands or the feet even more. Now, if you have heart or lung complications, I often discuss with other specialists like the lung doctor or the heart doctor, and we choose the best approach for my patients. But let me tell you something very important. All of these medications are just one piece of the puzzle, because if you want long-lasting results, if you want to prevent taking more and more medications, if you want to use fewer medications, lower doses of the medications that I mentioned, then what you do day by day in your life, it matters. This is why I teach my patients about the value of incorporating an anti-inflammatory diet. So my friends, eat plenty of fruits, vegetables, whole grains, and healthy fats like omega-3s. And please avoid all processed foods and excess sugar, and cook without seed oils. Remember, everything that comes in a box is processed food. And then don't forget to stay active, because gentle exercises like yoga, swimming, Walking for 30 minutes every day will help you reduce the stiffness, will help you maintain your joints and muscles very strong, and will improve the circulation and learn how to deal with the stress in your life. I know dealing with an autoimmune disease can be very stressful. Being a young mom, a young professional, a young father can bring you a lot of stress. And even if you are someone that retired, you can still deal with a lot of stressful situations, like your health, your finances, or losing someone dear to you. I know we cannot avoid stress, but we need to learn how to deal with stress to affect us less. Why? Because the more stress you have, the more likely is that your disease, your autoimmune disease, to cause you many troubles and have many flare-ups. Now, did you consider relaxation techniques like mindfulness, meditation, or even guided breathing exercises? I actually teach all of this in my latest book, Thriving with Rheumatoid Arthritis. But the same techniques that I teach in my book, that will apply to you. It doesn't matter if you have MCTD or lupus or scleroderma or another autoimmune disease. And last but not least, you have to prioritize your sleep, because poor sleep will worsen inflammation and will increase the pain. Every night, your goal will be to sleep for about 8 to 9 hours. These lifestyle changes may seem very simple to you, but they can have a big impact on how you feel. And now that you have learned how to treat MCTD, listen to the story of this patient who took years to be diagnosed with this autoimmune disease and developed many complications. So make sure you don't ignore these symptoms.